Yeah, so this was a group of older people. Average age was around 68 years old. One of the really interesting things is that these were people that were recruited from the community and didn't intrinsically have any sleep complaints. So they were not necessarily complaining that they had snoring or any other, sort of breathing issues with sleep apnea. We're not complaining of any, cognitive complaints. We're not complaining of any sleepiness. But we showed that when we recruited this population that sleep apnea is enormously prevalent. And prior studies have shown that sleep apnea in an elderly population is present at around the rate of 50%, so it's extraordinarily prevalent. And we were seeing essentially the same thing. About 50% of our population had sleep apnea. And so what was really interesting was that even though these people are not complaining about anything per se, right? Not complaining of snoring, not complaining of other cognitive issues, we saw that we identified a population that had apnea, and when we kind of pushed the system and really tested them on this ability to remember space and spatial navigation, that in fact there was a deficit even though they didn't have any other issues. I think that's the next obvious question is, is this kind of deficit something that's fixable? Is it reversible? If you treat people, does it get better? We'd like to think that that's likely to be the case, but I think that remains to be seen. And, therapy runs the gamut from CPAP to oral appliances to positional therapy to, as you mentioned, upper airway stimulation. And, I think by and large they all work well in people and they're effective, and we can show that with therapy people's number of apneic events per hour goes down to close to zero. But yeah, we really need to figure out whether or not that ends up impacting these cognitive outcomes, I think, in the big picture.